So I have, as you know, medical issues associated, just going back since I was 17. And with those issues going back since I was 17, there's been multiple transplants. I think I've had two. There have been more surgeries than I care to count. I've been to the point of the brink of death on at least once or twice. I've had a obscenely painful life at times. And so when I ended up getting the vaccine, there's a question of whether or not the vaccine would even work in the way that it's expected to work. There's some vaccines that don't work with me. I mean, I think it's the hepatitis C or D, I forget which one, but they have to basically continuously monitor during lab work to ensure that there's no issue with that because my body doesn't create the immunity for it once given the vaccine for it. Um, I say that to say this. Even though I've taken the vaccine and I still follow many of the guidelines in regards to masks when in spaces and everything else. If I'm in a restaurant, fair enough. And to be fair, I do take more liberties than I did prior, meaning I would go to a restaurant, I would go to a particular place, whereas beforehand that stuff was off the table. Especially when we're traveling, it seems like it's this feeling that the virus is somewhat over. But that feeling is not indicative of reality. Going back to June, we've had over a 400% increase in the number of cases. And in the United States, the Delta variant, which is more transmissible, they're saying is transmissible as chickenpox, is the prevailing variant that is here. Is my vaccine going to work? Does my body create the necessary cells and everything else? Meaning, do I have a functional immune system? Under normal circumstances, I don't have any issue with immunity issues. By the same token, I don't know. What about the rest of the population? Now, many of the population that got vaccinated, I think we're at 49%. Well, those people got that vaccine because they thought, this allows me to go back to life. 600,000 Americans died. I don't want to be one of them. I don't want to be the person that gets sick and that type of stuff. And I don't want to transmit it to anybody else. So I'm going to get the vaccine. And they did it. They got it. And they tried to get back to some semblance. They kind of pulled back and let those people get back to a normal life. What changed? What changed? People are like, it's whiplash that they've changed their policy. Joe Biden just came out basically saying we're going to bribe people with $100 if they get the vaccine, or we're trying to get the states and localities to do that. We're going to get that much more stringent, meaning putting in mandates or rigorous testing. And they gave guidance that even people who are vaccinated should wear masks when they're in public spaces. Meaning this notion that, okay, anybody can go into a building, and if you're vaccinated, you don't have to wear a mask. And of course, since nobody is checking, there's no way to know whether or not unvaccinated people are wearing masks. Most likely they are, since they didn't get the vaccine. And many of the people who didn't get the vaccine didn't believe this stuff was an issue anyway. They've upped the ante in what they're trying to do and trying to accomplish because the previous strategy didn't work. With 49%, you don't have enough for any level of a herd immunity. And even with the 49% being vaccinated, variants change the equation. If I am bulletproof, more or less, because at one point in the United States, you had 99% of the people who were going to the hospital were people who were basically unvaccinated. Well, that looks like a magnificent bit of evidence to show that if you're vaccinated, your chances of getting it are relatively low, or that much lower. For God's sake, 1%, right? What about the variants? Now, this has been a question that I've been asking for a while, especially on the show. Is the vaccine strong enough, resilient enough to deal with variants? Now, the variants become an issue because there are all sorts of mutations that take place in the virus. And for COVID, the mutations have been somewhat significant in weird ways. But the mutations may make it not quite right. Meaning what your body does in regards to pushing back the virus. This kind of locking mechanism, this getting your immune system aware and everything else. It may be just different enough where the vaccine is not as proficient at dealing with it, or for that matter, preventing the person from getting sick. That is the fear for variants. The Delta variant is one of those variants. In July, there was an outbreak in Massachusetts, Cape Cod, if I'm not mistaken, or the typical Cape Cod. And in that outbreak, the CDC did a study on that outbreak and released the results on Friday. And what they found were that 79% of the people that were sick, that got the virus, were vaccinated. Vaccinated, meaning they had their vaccines. And yet, 79% in that outbreak got sick. When you see a number like that and you're vaccinated, that makes you queasy. And if you are the Biden administration, who considers him handling the virus, keeping the numbers down to be existential, that will make you queasy. The United States is now highest in the world, once again, in the number of people who are getting sick from COVID. The deaths haven't necessarily followed yet, but deaths may not follow in the numbers that they were before because you do have 49% of the population getting vaccinated. With numbers like that, 79%, you can imagine that in the wild, in the open, the question became up, okay, what is the protection that the vaccines give? Now, what they came to the conclusion was, well, yeah, the vaccines do work. The people who got sick, none of them died. Many of them didn't even get that ill. The overwhelming majority were perfectly fine. And so, whereas in the wild, in the people without those vaccinations, it seemed that those people have a higher propensity of death and a higher propensity for serious illness, whereas in this case, it was mild. And so they're having this kind of weird thing of trying to skirt to two things. The most important part of this was, despite it being mild for the individual, meaning so for the person who's vaccinated, okay, this isn't going to kill me because I'm vaccinated, even though it feels crummy. The point and the problem was this. The data detailed by the CDC's Morbidity and Mortality Weekly Report helped convince agency scientists to reverse recommendations. Critically, the study found that vaccinated individuals carried as much virus in their noses as unvaccinated individuals, strongly suggesting that vaccinated people could spread the virus to each other. Vaccinated people, despite them not necessarily dying, spreads the virus as well as people who are not vaccinated. That's not good news. And again, this is the Delta variant. I've went over the stats and everything else once before in regards to the number of people. I think it was 76,000 were infected. I think 312 or 314 died. Here's the catch. And I want to put context on this, because it is somewhat of a worrying story if you look at. One of the other interesting stats, though, before I add context, right here. The Washington Post obtained data on, well, I just read it. CDC internal documents obtained by the Washington Post estimate that 35,000 vaccinated people a week in the United States are having symptomatic breakthrough infections out of the vaccinated population of more than 162 million. Vaccination coverage is higher than average in Massachusetts, with nearly 70% of residents fully vaccinated. All right, so a few things. Because Massachusetts has so many people that are vaccinated, the only people who are going to get sick, more or less, who are available to get sick, 70% of which are vaccinated people. And so if there's a breakthrough or if there's anything else that's running through the community, well, those people just so happen to be vaccinated. So those are the people who are going to be sick. It's just who's there to receive the illness in the first place is that. Again, the catch becomes, though, it's far milder for the people who are basically vaccinated. Those people tend to not die or die extraordinarily less. However, they spread it just as readily as anybody else. And they move around just as readily as anybody else, meaning despite their community having these high vaccination rates, other communities may not have these high vaccination rates. On the other part of, beyond that point, it's a party town. And because it's a party town, you basically have people who are probably mingling, partying. Because so many have vaccinations already, they probably feel confident that they're not necessarily going to get ill. And they were probably going back to some level of normality. But the problem here is this level of normality is basically the safe space for COVID. I mean, this is its maximum habitat. And for something like a Delta variant that is highly transmissible, people in close spaces, people in these kind of not necessarily wearing masks, going back to restaurants, going back to stores, not wearing masks, feeling protected, feeling perfectly okay, feeling back to a certain level of modernity. Yeah, It's the perfect spot for COVID. And so it's not like a situation of people in, let's say, other states where they may not be that densely packed because they're partying and everything else. They may not be super spreader events. In this case, it seemed to be something similar to a super spreader event. It's a perfect storm. When you push this out to the regular society or community and everything else, well, people may not be that close together, and people may not be engaging in this kind of, let's say, mingling. Other areas may have something different. They may have different standards, especially if the number of vaccinations aren't that high. They may have different even mandates in regards to masks and whatnot in regards to the local communities. So immediately going back to basically the mask guidance and everything else, well, what they're going to do is they're going to say, okay, people need to wear masks again. And they're going to say people who are even vaccinated need to wear masks when they're indoors, safe spaces. They're trying to level or limit the number of safe spots that COVID can basically affect the population. And so areas like Cape Cod, where these guys were mingling and everything else, they're saying, yeah, don't do that. And the catch becomes, if people were still wearing masks, despite the fact they were vaccinated in some of these spaces, would the number of the cluster be as high as it was? And of course, the answer to that is no, it wouldn't have been as high as it was. Hence, the change in guidance. That's not something that anybody necessarily wants to hear who's been vaccinated. And, you know, the point that needs to be gotten across is that despite the fact that you are not bulletproof, you were never bulletproof from the standpoint of the vaccine. And again, the Delta variant, this is something that's happened in Massachusetts. We haven't necessarily seen this everywhere. And if we're looking at percentages, you're talking about what, 36,000 compared to 162 million that were vaccinated. It's not massive numbers in comparison to the general population that is getting sick, that is dying, the preponderance of which unvaccinated. This is also the aggravating thing that I've been screaming about, that your individual liberty, what about my individual liberty to not get sick from a virus that you were spreading? Petri dishes. The people who are that much more likely to spread the virus, spread the virus, less likely to wear masks, less likely to do all of this stuff. Those are the people that were the petri dishes that allowed this thing to mutate into something else. And yes, I know it didn't necessarily mutate in the United States. It came from somewhere else. But regardless of that fact, the goal of this was to knock down the virus to such a degree because of the numbers of people who were vaccinated. That's not happening. That's not necessarily going to happen now anyway. We're going to see what happens with the new policies Biden is putting in place. This explains why he got that much more tougher on this. So he is putting on companies. Basically, he's anybody who's going to work with the federal government, federal contractors, and federal workers must get a vaccine. I had to get a vaccine before I went back to my job. And in this case, for the standpoint of the federal government, Joe Biden basically said the same thing. You got to get a vaccine. On top of having to get a vaccine, he also kind of went with this notion that if you're a federal contractor, same thing. If you don't want to get the vaccinations, he allows you an out with rigorous testing over the course of the week. And again, testing is somewhat dodgy, right? Because that test has a high fail rate. But supposedly that's why they're doing it multiple times over the course of the week. He's trying to get provisions to allow employers to allow people time off to get the tests. And that's the part that's interesting, right? He's basically begging them to do that. He's bribing, giving $100 to try to get people to take it on. I strongly suspect that he is talking to various companies to try to get those companies to change their policies to insist, as a tenet of coming back to work, that they get vaccinated. And how could I blame them? If my job wants people to come back, and the job says, all right, we want to ensure that the people here are safe and we have a safe, healthy working environment. Great. The people who are vaccinated are not bulletproof. And so if all of them are vaccinated, at the very least, your chances of getting it are far less. Your chances of getting it if you're ill are far less. Your chances of dying are far less, et cetera, et cetera, et cetera. And depending upon where you are, if everybody in your office is vaccinated, or if you have a high number of people that are vaccinated, you may have a certain herd immunity just within the context of your office. I guess the point I'm getting at is I can't fault an employer for wanting to ensure that somebody there is not spreading something and to do due diligence to ensure that their employees are safe. Basically, Joe Biden is doing the same thing. We're going to see what this does, whether this lowers the numbers, whether it ups the number of people who are vaccinated, etc., etc. But putting all that to the side for the moment, the Delta variant has been found to be highly transmissible, highly formidable in regards to its capacity to compete with the other coronaviruses. Is the predominant one in the United States. And if the conditions are apparently right, it can even blow through the immunity posed and created by the vaccines. It's not a good study. There are going to be others, and we're going to see what those others say. I mean, again, up to this point, it's like 90% of the people, or 99%, or 95, whatever, total across the United States. And so we'll see. One study is not the end-all, be-all, and does not, the study has to be repeatable. But if they're seeing spikes, and they're seeing these spikes in areas of people who are vaccinated, that has to change the calculus. Has to. Because at that point, the vaccine in and of itself wouldn't necessarily be enough to prevent people from getting sick. And even if people aren't necessarily getting vigorously sick, they're still basically spreading it to others. It becomes problematic. If the vaccines lose their effectiveness, what else is in the arsenal? I'm going to say like, share, subscribe.